nursing problems. The main purpose of the care plan is to direct nurses who will look after Sumira in the future on how to care for her to help achieve optimum health in a safe and measurable way, but also involve the patient and their family in the planned care. This module will give great insight into writing the care plan. You will learn how to structure it to be easily understood by the whole of the nursing and healthcare team as well as the patient and their family. Care plans all follow the same structure in the OSCE, and in practice, this helps each nurse easily understand them. The paperwork for the planning station follows a certain format, the same as the picture below, except it will say nursing interventions on one side of the page and self-care interventions on the other side. Problems. For the OSCE, you can use either a nursing diagnosis or a nursing problem. If you are familiar with NANDA's taxonomy and formatting a nursing diagnosis, using NANDA international structure. In the OSCE, straightforward nursing problems are acceptable. For the purposes of this training tool, all problems will be written as nursing problems. What is a nursing problem? It may be helpful to identify firstly what a nursing problem is not. A nursing problem is not a medical diagnosis, although it may refer to the disease or injury causing the problem. The problem is not that Sumira has a head injury. Look for signs and symptoms to include in the problem. Nursing problems fall into three broad categories. Number 1. Identification of a patient's experience of a health problem. Sumira is experiencing confusion due to a head injury. Number 2. A patient health risk or need or a predicted need. Sumira is at risk of falls due to poor mobility and a decreased level of consciousness. Number 3. A patient's inability to complete an activity of daily living independently. Sumira is unable to maintain a safe environment due to confusion. Note: all nursing problems should be something a nurse can either minimize or solve. For example, there is no point in writing organize X-ray and CT, as this is not something a nurse can do. Your nursing care plan must concentrate on the work of nurses. Choosing a nursing problem. After all the health information has been gathered from the patient in assessment, you will be able to define the nursing problems. In order to do this, you will reflect on the information, identify abnormal data they are concerned about, and write up 2 nursing problems for Sumira. A lot of information was obtained during the assessment, and it can be difficult to give it order and structure. How to organize patient nursing problems? There are several different ways for nurses to organize patient data to form nursing problems. Roper's Activity of Daily Living, ADLs, are the model used for care planning. The OSCE admission document that was given to you at the start of Sumira's assessment uses the activities of daily living to assess Sumira's abilities. Using Roper's ADLs to plan patient care is common practice in UK healthcare settings. It is commonly used as a type of checklist to identify if nursing support is needed to complete each activity. In normal daily practice, a patient's independence is assessed against all of the activities of daily living with one AOL at a time. It would take too long to ask about all 12 ADLs, so in the OSCE, you can only make a brief assessment. In the exam, the admission book has been completed for you by an earlier nurse, and the AOL checklist has been partially completed. However, the planning has not been done, so you can write any care planning ideas on the blank AOL forms that you have been given. The patient, Sumira, has 2 immediate problems and AOL deficits: communication, maintaining a safe environment. Although she does have other lifestyle choices that are not conducive to her health, which fall under any other of the 12 AOLs and which may or may not be contributory to her fall and injury. You can write a plan of care about reduction in alcohol or stopping smoking, but perhaps include them as interventions rather than the main problems. At least one care plan should reflect the immediate problem she was admitted with. Using the Roper-Logan-Tierney's ADLs to organize the information obtained in Samira's assessment, use your critical thinking skills to assess Samira's ability to meet these ADLs.